COVID-19 symptoms to watch out for in children. This video is done in coordination with the Society of Ibero-Latin American Medical Professionals. Better Latino health through better healthcare education.
Video today is about COVID from a nurse's perspective, school nurse's perspective especially. Now, the main topic is, how do I know if my child has COVID? This is part one of a two-part video series. So if you watch this video, I'll share with you a public service announcement. This is not medical advice, but a public service announcement. But I think I could provide some useful information for all children. And I think I have some useful information for parents of special needs children that also have a problem with communicating. So we've all heard that COVID-19 symptoms are milder in children than they are in adults. So 90% of the children that had a positive test for COVID did have mild symptoms or none at all. Many of us would think then, why worry? Why should we care? So there's some reason to worry though, because not only can those children get other people sick, but they can also be sick and it can go unnoticed. So by now, many of us know that a fever and dry hacking cough are the common symptoms of COVID-19 in adults and kids. But the shortness of breath thing is where the problem lies. See, if an adult has pneumonia-like symptoms, when the COVID gets really bad and gets severe and dangerous, adults are more likely to have shortness of breath than children. There's been a lot of situations where children have not demonstrated shortness of breath, but they did have severe symptoms. So we can end up having a child with pneumonia without obvious symptoms. Now, statistically, it doesn't happen a lot, but it can be a big problem because pneumonia without easy telltale signs can really be a scary thing. So what should we look for in our children? That's a pretty big question, but some things we should be doing is looking at our children and paying attention to them and paying special attention to your children if they have immune conditions due to medication issues or illnesses. And if your child has asthma or heart trouble, because those children are in the category of the immunity, more likely to get it, and also getting very sick. And the asthma and heart trouble, they are in the category of possibly getting sicker than your average child. So some other things that we should be looking for, and these are basically symptoms. Does my child have a sore throat? Does he or she have diarrhea? Does she appear run down or tired today? Sometimes children can get a skin rash too. So is there an unusual rash? These aren't all the symptoms of COVID, but if your child has any of these, and especially the cough, the dry hacking cough, the shortness of breath ones that we talked about earlier, and fever, call your pediatrician. Now, for your parents that have special needs children that aren't able to communicate that well, that can really be a big problem. And believe me, I know, working with children for a number of years, and especially your children that have communicative issues, it really takes a lot of investigation sometimes to find out what's going on because they can't tell us what's bothering them. But in my near 20 years of experience of working with children, I found that one of my best barometers if something's wrong with a child happens to be the caretaker, the person that's with that child every single day. And the best of all are normally the family at home and the parents and the guardians. They know best. So parents, caregivers, please trust yourselves. Give that child the eye test. Does he or she look right today? Something doesn't look right. I don't know. Trust your eyes. Try to figure out what it is and put trust in yourself and your instincts, because more often they're going to be right than they are wrong when it comes to your child. So if you feel that something's wrong, please do not be afraid to call the pediatrician, especially so if your child develops a fever or cough. This is the end of this video. I wanted to keep them short for some people that don't really like to listen to long videos, but I do have a part 2 of this video, and that will talk about when should you consider emergency care. So if you found this video to be useful and you see it on YouTube, please hit like or share it. And until the next time, this is Mike, your school nurse, saying goodbye.